Scott, thanks so much for talking with us. Can you take us back to the moment when you first realized that Lucy would need surgery? She would need to go to the NICU. What were those early days like for you and your family?
We kind of found out right after she was born that she was struggling to breathe pretty significantly. The nurses were trying to do what they could to get her oxygen levels up. She came out a little blue, and it all went very quickly. Ultimately, they called in the NICU nurses, whisked her right up to the floor above the NICU, and it took us by total surprise. We had no idea kind of leading up that anything was wrong. And it was quite a mix of emotions, right? You start with, elation from having a brand new little one. This was our first kiddo, to then the shock and worry of having a kid that wasn't healthy and might have some major issues. And so that was obviously very, very stressful and a really significant mix of emotions.
Yeah, as a parent, I can't imagine going through something like that. So the doctors told you that she would need surgery because her jaw was too small. So what did this diagnosis mean?
So we kind of knew shortly after going up to the NICU that they had figured out what was wrong. So she had a very small jaw as well as a cleft palate, something they call Pierre Robin sequence. Finding out that she needed surgery was obviously very, very scary, but also a little relieving because we knew that we had to fix the problem and we knew that there was an option to do so.
How was it watching your daughter go into surgery? And how did the whole team there at Penn Health Children's Hospital really wrap their arms around you and let you know that it's going to be okay?
It was actually interesting. I did my medical school at Penn State, and I did rotations with our surgeon, Dr. Henry, and I knew the anesthesiologist. He was a class below me in medical school, and so I felt very comforted because I knew they did a wonderful job. I knew they were in good hands, but obviously it's still very scary, right? And knowing the post-op recovery, which you would have to go through even a week after the surgery, was obviously very scary. But I knew I was in good hands from the physicians we were working with, as well as the nursing staff was very comforting.
So how did the surgery go and what was the outcome like?
So she had something called a mandibular distraction. So basically, they cut her jaw on both sides, put in some metal hardware, and then over the course of a week, expanded her jaw bit by bit. And so through that entire time, she had a breathing tube down because of the risk of breathing with doing those expansions. And so that was definitely the hardest time that my wife and I had to go through, is watching her with a breathing tube. And, one thing I will never, ever forget is watching a baby try to cry and nothing coming out, right? They
Mhm.
can't make any sounds. And that was just the hardest, most gut wrenching part of it. But eventually we got through it. She got the breathing tube taken out and she did great. She could breathe on her own. It was wonderful. But it was hard to go through for sure.
Now that you're on the other side of this journey, what advice or words of encouragement can you give to our viewers who may be going through something similar to this?
Don't do it alone. We were very fortunate that, we made some friends uh, in the NICU. We called them our Bay Buddies. And it's really hard for somebody who hasn't done it before or isn't doing it to understand what you're going through as parents. And so when you make those connections with people who are doing it and going through it with you, that made all the difference.
Thank you, Scott, for being with us, and so glad that Lucy is doing so well.
We are too. Thank you.